Well, after my surgery, I get out of the chair with no pain, but before surgery, I needed somebody to help me get out of the chair. It hurt so bad.
To sit in a car, to even walk, I mean, it was so painful just to walk, and I had a limp. I was just in tears all the time with the pain.
When it comes to Dr. Necci, I think he's one of the best, and he's a real gentleman, and he did a great job on my hip.
Dr. Necci is a fabulous, fabulous doctor.
You know, here at AIM Orthopedics, we treat each patient with compassion and individualized care. Each patient is different, each hip is different. You know, we're not just a machine where you come in, you get an x-ray, and we sign you up for surgery.
My stay at the hospital was only overnight, and the next day I went home at noon. I think about 5 hours after surgery, they got me up and I walked down the hall, which really surprised me that I could walk.
I was in the hospital for approximately 3 days. They made me feel very comfortable, and it was a fabulous day. I felt like I was on top of the world after the surgery. You know, I thought I could just run down the hallway. It was great. Everything was wonderful. I felt special.
It's usually a one-night stay in the hospital, so you come in, you have the surgery, and 95% of patients are going home that following day. They're doing home exercises at home, and then we see them back in the office a week later and then start them in outpatient therapy, and they're usually in outpatient therapy for about a month.
After my surgery, I think I had to wait 2 weeks before I started therapy. And then I went 6 weeks therapy here, and people treated me really nice, and the therapist really helped me a lot.
And then when I came for therapy, and after probably a month and a half, I could go for a walk. I could sit in the floor and be able to get up out of the floor without, any difficulties.
I could do anything I wanted to do. I started golfing after 6 weeks. I dug with a shovel after 6 weeks.
The biggest difference for me is those first 4 to 6 weeks after surgery. Patients do so much better, so much quicker, and they're happier.
After 2 years of my surgery, my pain is actually zero, and that's hard to believe, but it's the truth.
I don't have any pain now.
I would say that without a doubt, patients come back to me that first visit, and oftentimes they're walking without a cane, even on that first post-op visit, and they come in and they just say, I don't know why I waited so long. Those are the things that as a surgeon, that's why we got in and did this, is because you can make such a dramatic improvement in patients' lives, the quality of life that they have.